Welcome to Med Survival Mnemonics. Ever had your heart race during a stressful moment? Maybe during a big presentation or watching a scary movie? Imagine if your heart kept racing and you weren't sure if it was from stress or something more serious. Today, we're taking on tachyarrhythmias, those sneaky arrhythmias with a heart rate of 100 beats per minute or more. But don't worry, just like assembling IKEA furniture, but easier, we'll break them down step by step. There are two important steps when approaching EKGs with tachycardia rhythms. Step 1. Tachycardias are broadly categorized based on the width of the QRS complex. Narrow QRS complex, less than 120 milliseconds, reflects rapid activation of the ventricles via the normal His-Purkinje system, suggesting the arrhythmia originates above or within the AV node. Wide QRS complex, 120 milliseconds or more, or 3 small boxes, happens when ventricular activation is slower, usually from arrhythmias originating below the AV node or involving an accessory pathway. Step 2. After determining QRS width, check if the rhythm is regular or irregular. This will help you narrow down your differentials. First, narrow complex tachycardias. Key here is to always look at P waves to differentiate narrow complex tachycardias. If the rhythm is regular, possible causes include sinus tachycardia, normal P wave, supraventricular tachycardia with absent P waves, or atrial flutter with sawtooth P waves. If the rhythm is irregular, possible causes include atrial fibrillation with no P waves, multifocal atrial tachycardia with 3 or more different shapes of P waves, or atrial flutter with variable conduction with sawtooth P waves. Now let's jump to wide complex tachycardias. With a regular rhythm, possible causes include ventricular tachycardia, VT, sinus tachycardia with aberrancy, or SVT with bundle branch block or WPW syndrome. If the rhythm is irregular, possible causes include ventricular fibrillation, Torsades de points, or Afib with bundle branch block or WPW syndrome. Grab your EKG ruler, some caffeine, and let's decode these rhythms together with 12 EKGs one by one. Case 1. 20-year-old female with anxiety, chest pain, and palpitations. Step 1. This is a narrow complex tachycardia as QRS is less than 120 milliseconds. Step 2. The rhythm is regular. Take 5 seconds to examine the EKG. No pressure. You've got this. Look at P wave morphology. The 3 differentials are 1. Sinus tachycardia. 2. Supraventricular tachycardia. 3. Atrial flutter. Final diagnosis. It's sinus tachycardia, confirmed by the presence of normal P waves. This is the heart's way of saying, I'm just stressed out, okay? Case 2. 75-year-old male with coronary disease, heart failure presents with weakness and palpitations. This is a wide complex tachycardia as QRS is more than 120 milliseconds. The rhythm is irregular. Study the EKG for 5 seconds. Don't let the wide QRS intimidate you. It's just a clue. Look for any bundle branch block. The 3 differentials are 1. Atrial fibrillation with bundle branch block. 2. Torsades de points. 3. Ventricular fibrillation. Final diagnosis. Atrial fibrillation with left BBB, confirmed by the irregular rhythm and the left BBB pattern. Always check prior EKGs to see if this BBB is new or old. Case 3. 52-year-old male with sudden palpitations at rest. This is a narrow complex tachycardia, QRS less than 120 milliseconds. The rhythm is regular. Take 5 seconds to admire those sawtooth P waves. They're trying to tell you something. The 3 differentials are 1. Sinus tachycardia. 2. Supraventricular tachycardia. 3. Atrial flutter. Final diagnosis. Atrial flutter, confirmed by the characteristic sawtooth waves. Case 4. 89-year-old patient with extensive cardiac history now presents with fever and low blood pressure. This is a wide complex tachycardia, QRS more than 120 milliseconds. The rhythm is regular. Take 5 seconds. You're almost a detective with these EKGs. Look at the shape of P waves. The 3 differentials are 1. Sinus tachycardia with aberrancy. 2. Ventricular tachycardia. 3. Supraventricular tachycardia with bundle branch block. Final diagnosis. Sinus tachycardia with aberrancy, confirmed by normal P waves. Case 5. 75-year-old patient with heart failure history now presents with shortness of breath. He was found to have pulmonary edema. This is a narrow complex tachycardia, QRS less than 3 small squares. The rhythm is irregular. Give yourself 5 seconds finding any P waves. Irregular rhythms love to keep you guessing. The 3 differentials are 1. Atrial fibrillation, 2. Multifocal atrial tachycardia, 3. Atrial flutter with variable conduction. Final diagnosis, atrial fibrillation confirmed by the absence of P waves. Time to control the rate or rhythm and anticoagulation. Case 6. 68-year-old male comes with syncope. This is a wide complex tachycardia, QRS more than 120 milliseconds. The rhythm is irregular. Take 5 seconds and enjoy those twists around the isoelectric line. The 3 differentials are 1. Torsades de points, 2. Atrial fibrillation with bundle branch block, 3. WPW syndrome with atrial fibrillation. Final diagnosis, torsades de points, identified by the twisting of the points. Electrolyte correction is key here. Case 7. A 65-year-old male with chest pain and lightheadedness during exertion. This is a wide complex tachycardia, QRS more than 120 milliseconds. The rhythm is regular. Analyze this EKG for 5 seconds. Might not be enough though. The 3 differentials are 1. Ventricular tachycardia, 2. SVT with bundle branch block, 3. Sinus tachycardia with bundle branch block. Final diagnosis, ventricular tachycardia, confirmed by the extreme right axis deviation, lack of P waves, and AV dissociation. Here are 2 characteristic fusion and capture beats of VT. Fusion beats occur when both supraventricular and ventricular impulses hit the same time. Capture beats occur when a normal impulse is conducted through to the ventricle. Case 8. A 70-year-old male with COPD and shortness of breath. This is a narrow complex tachycardia. The rhythm is irregular. Take 5 seconds to study those wild P waves. The 3 differentials are 1. Multifocal atrial tachycardia, 2. Atrial fibrillation, 3. Atrial flutter with variable conduction. Final diagnosis, multifocal atrial tachycardia, confirmed by 3 different P wave morphologies. Treat the underlying COPD. Case 9. 23-year-old male with palpitations and pre-syncope. This is a wide complex tachycardia, QRS more than 120 milliseconds. The rhythm is irregular. Take 5 seconds to spot those delta waves. The 3 differentials are 1. Torsades de points, 2. Atrial fibrillation with WPW syndrome, 3. Ventricular tachycardia. Diagnosis, atrial fibrillation with WPW syndrome, confirmed by irregular rhythm and delta waves. Avoid AV nodal blockers here. Case 10, 17-year-old male with palpitations while gaming. This is a narrow complex tachycardia, QRS less than 120 milliseconds. The rhythm is regular. Take 5 seconds. Gaming and tachycardia, it's a thing. Good luck finding any P waves. The 3 differentials are 1. Supraventricular tachycardia, SVT, 2. Sinus tachycardia, 3. Atrial flutter. Final diagnosis, supraventricular tachycardia, SVT, confirmed by absence of P waves. Treat with adenosine or AV nodal blockers. Case 11, 65-year-old female with chest pain and palpitations. This is a narrow complex tachycardia, QRS less than 3 small boxes. The rhythm is irregular. Take 5 seconds to analyze those sawtooth P waves. The 3 differentials are 1. Atrial flutter with variable conduction, 2. Atrial fibrillation, 3. Multifocal atrial tachycardia. Final diagnosis, atrial flutter with variable conduction, confirmed by the characteristic sawtooth P waves. Case 12, 48-year-old male with cardiomyopathy and history of ablation. This is a wide complex tachycardia, QRS more than 3 small boxes. The rhythm is regular. Take 5 seconds to examine the left BBB pattern. The 3 differentials are 1. Ventricular tachycardia, 2. Supraventricular tachycardia with left BBB, 3. Sinus tachycardia with left BBB. Final diagnosis, supraventricular tachycardia with left BBB, confirmed by the normal axis and absence of P waves. And there you have it, the world of tachyarrhythmias decoded in one epic session. If this video struck a chord with you or a rhythm, don't forget to hit that like button, subscribe to Med Survival Mnemonics, and click the bell so you'll never miss our future uploads. Until next time, stay calm, study hard, and remember, the heart may skip a beat, but your EKG skills shouldn't.